It's 8 a.m. from Fox 35. This is Good Day Orlando.
All right, on the Health Watch this morning, the percentage of twin births in the U.S. has nearly doubled over the past 4 decades. While many women who struggle with infertility see having twins as a blessing, experts are now calling for increased measures to reduce multiple births because there are, of course, health risks. And joining us this morning to talk more about that is Dr. Trolice with Fertility Care. Always great to see you, Dr. Trolice. Thanks for coming to visit us.
My pleasure. Anytime, Amy. Good morning.
So let's talk a little bit about why this is happening, because I imagine you very often have patients who come to you who've been trying for a very long time to get pregnant, and they say, you know what, my odds of getting pregnant are so slim. How about we try putting more than one egg in, and then they hope, gosh, maybe I can have more than one baby. Do you hear that story quite often?
All the time. Patients who've been trying to conceive for a while really want to build their family. So they look at, if they need to go to in vitro fertilization, they look at, hey, if I have twins, I have my family and we may be done. The problem is that twins clearly increase the risk of complications during pregnancy. Preterm labor, low birth weight, respiratory, neurological problems, handicap, and even mortality. Now, to put in perspective, about 1% of IVF, deliveries in the country, 1% are from IVF. And of those 1%, about a quarter are twins and 1% triplets or more. Okay, so we are definitely seeing a decrease in the number of multiple births because we're aware of the complications. Twins are still going up. So this study that came out is looking at the fact that we want to reduce the risk of multiple births. How do we do that? Well, patient education, but also increasing insurance coverage. Amy, it's so sad that these patients have to struggle and pay for infertility when the World Health Organization clarified and classified infertility as a disease. So patients see the cost of IVF. They don't want to go through multiple cycles, so they'll increase the risk of multiples by transferring more than one embryo.
Sure, which it makes sense because they think, my gosh, well, I can't afford to spend $50,000, $60,000, $70,000 along this long process if it doesn't work out the first time. Talk to me about some of those inherent risks of twins, triplets, and not only to the babies but to the mother. What are some of the risks that we're looking at?
Absolutely, twins and multiples is a risk not just to babies but to mom. Mom has an increasing risk of high blood pressure, diabetes, cesarean section, and those complications as well. So it comes down to the fact that without insurance coverage, it makes it very difficult for patients to say, I'll take a single embryo, and then if it's not successful, I'll try the next cycle and see how we do. But that next cycle is also a cost, even though it's a frozen embryo replacement cycle. So the key to this is to increase insurance coverage for this, so that patients, if they're not successful with a fresh IVF cycle, they'll have a frozen cycle and still be able to have a very good outcome. And also, we have to increase awareness to the fact that multiples is not an easy pregnancy. It's a high-risk pregnancy.
Right, yes, very much so. And especially oftentimes the mother's age is up there, too. Tell the people at home how they can find out more about you. Website or their information?
My website is www.myfertilitycare.com.
All right. As always, Dr. Trolice, a pleasure. Thanks for coming in this morning and talking to us about this.
Anytime, Amy.
We appreciate your time.